pleasant good afternoon to everyone. It is an honor to stand here before you. I'm looking at some beautiful faces. I want to thank you, first of all, for coming out this afternoon to this important lecture series. It is both an honor and a privilege to welcome you to the inaugural public health lecture of the Heart and Stroke Foundation, a milestone event as we celebrate our 5th anniversary of service, advocacy, and commitment to cardiovascular health. Over the past 5 years, we have worked tirelessly to raise awareness, support individuals and families affected by cardiovascular diseases, and promote healthy communities. The statistics speaks for themselves. Cardiovascular diseases claim approximately 17.9 million lives each year, making them the leading cause of death globally. Diabetes, affecting 400 million people worldwide, and obesity, impacting more than 650 million individuals, are major risk factors and further increase the burden of heart disease and stroke. However, prevention and management remains within our reach. Through healthy lifestyle choices such as balanced nutrition, regular physical activity, and avoiding tobacco and excessive alcohol consumption, we can significantly reduce the risk of heart disease and stroke. For those already affected by non-communicable diseases, early detection, proper medical management, and education on self-care are vital for improving health outcomes. This afternoon, we bring you 3 critical discussions that shed light on factors impacting cardiovascular health. The impact of chronic stress and anxiety on the heart. That presentation will be done by Dr. Ian Thomas, and he will explore how prolonged emotional strain can lead to severe cardiovascular consequences. The effects of cannabis on the heart will be presented by Dr. Garraway. As the conversation around cannabis use evolves globally, it is crucial to understand its potential cardiovascular risk and the latest research on this effect. Our final presentation, Understanding Stroke, Prevention, Recognition, and Recovery, will be presented by Dr. Gaydon Osborne. Stroke remains one of the leading causes of disability and death, and knowledge about its warning signs and treatment can be life-saving. We will also have 2 testimonies of persons living with NCDs. As we engage in these discussions, I encourage you to ask questions, reflect on the information presented, and take meaningful steps towards better heart and brain health for yourself and your loved ones. Once again, welcome, and thank you for being part of this special occasion. Together, let us continue our mission of saving lives, preventing diseases, and fostering a healthier future. At this time, we're going to invite Valerie to the podium as she breathes a word of prayer on this program this afternoon.
Good evening, one and all. Please stand. Let's bow our heads and bow our hearts. Heavenly Father, we thank you for this day. We thank you for bringing us through to this time as we continue to educate, bring awareness to how you should take care of your heart, preventing strokes. Lord, we thank you for the presenters here today. Thank you for blessing them with the knowledge that they can impart to us simply so we can clearly understand. And as we continue this lecture this afternoon, we ask you to be with us. And as we journey to our homes, take us safely. These things we ask in your name. Amen. Amen. Please Be seated.
Okay, just a bit of housekeeping matters. If you have your cell phone on, if you could please switch them to vibrate or silent, that would be great. The internet down here is not that great anyway, so you may not be getting calls. Before we go into our first presentation, we are going to hear about the history of the Heart and Stroke Foundation from our very own cardiologist and president of the Heart and Stroke Foundation, Dr. Georgette Meade.
Good afternoon, everyone. The foundation was launched on February 3rd, 2020. Our motto, Mind Your Heart. We co-founded by myself, Dr. Georgette Meade, Dr. Rashida Williams, and Ms. Sumita Beluja, who's also the vice president of the foundation. Ms. Valerie Gonzalez Barrero, MM, is our secretary, and Dr. Monica Osmond Stevens, our treasurer. Our patron is His Excellency Sir Rodney Williams, and our ambassador, Mr. Calvin Southwell. He also enhances the awareness in terms of stroke. And so, it helps each person to learn more about stroke. He did have a stroke, and so his story really touches many persons and helps them in terms of their recovery. There are numerous friends who has joined the mission, and that mission is to prevent heart disease and stroke. And by doing that, we try to focus on the risk factors and then the care of the patient having suffered these illnesses. A very, very important friend of ours, mascot, his name is Arthur. And if we're going to prevent these conditions, we need to start with the children. And so he's been sharing the message. We've been to 14 primary schools, several secondary schools, and we do these interactive sessions in terms of healthy eating and exercise with the students. While at the school, we also take the opportunity to do medical screenings for the teachers, and we also provide consultations for these very same teachers. So we're hoping that they, follow the message that we try to give them and the instructions and the recommendations made. And this year, as we celebrate our 5th year, we did visit the Brownies. We did have a very good time, and the Brownies group, they also learned quite a lot. Arthur was also present at that visit. So we try to spread the information, various means, whether by the Facebook, and I invite you to follow our Heart and Stroke Foundation page. So it's Heart and Stroke Foundation, Antigua and Barbuda. We also share the message via television, radio, interviews, and newspapers. And I'm sure you may have seen some of our public service announcements or heard them on the radios. But it's not just for you. We want you to share the message. We want all of Antigua and Barbuda and even the rest of the Caribbean, because these conditions plague all of us. And so strategies have to be put in place to prevent these conditions. Thank you so much again for coming out, and thank you for those on the YouTube channel following us today. Happy 5th anniversary to the Heart and Stroke Foundation, Antigua and Barbuda. And I want us to say hip hip, hooray, hip hip, hooray. Thank you so much again.
Okay, at this time, we are going to invite our very own nephrologist and internal specialist, Dr. Ian Thomas, to come to the podium with our first presentation. Welcome him.
Okay. Afternoon. Good afternoon, everyone. Again. Yeah. So you heard. Okay. So you've heard that I'm going to be talking about stress, anxiety, and heart disease, and I guess you can predict that there's a connection, right? Well, as physicians, we have been, we're taught about risk factors, and there's always emphasis placed on high blood pressure, diabetes, or sugar if you prefer, cholesterol problems, family history, lack of physical activity, obesity. But we don't typically talk or emphasize the connection between stress and heart disease. A few years ago, I remember distinctly a very pleasant elderly lady coming to see me at the office, and we had a nice chat, and after consultation she asked how I was doing, if I was taking care of myself, and you know what she said? Remember, doc, hurry and worry is what kill people. I chuckled, I smiled, but she's so right. Not that it's the only factor, but it is indeed a big factor. So stress, I think we can't escape it. No, I'm not, as you know, a cardiologist. I'm not a psychiatrist, but I, just like I'm sure all of us here in this room, have faced stress on a daily basis. And what is stress? Well, it's how we respond to some sort of challenge in our lives, or some sort of external threat. It could be a passing thing, it could be long term. And stress can lead to generalized anxiety or feelings of worry and fear. When, I guess thousands of years ago, our bodies, and well, not just our bodies, but before persons settled into cities, there were dangers lurking all around us. For example, wild beasts were on the prowl, and we would have this ability to activate our fight or flight response. This is helpful, but if it becomes, if you can't turn it off and it's present on a daily basis, it becomes maladaptive or harmful. Today, we don't have lions and tigers. I think the most dangerous thing in Antigua are Antiguans and Barbudans, right? But despite that, we have stress in our lives. Work stress is pervasive, financial stress, and even loneliness and social isolation. We're very connected now in the 21st century. We have better forms of communication. I guess decades ago, few persons had telephones. Certainly, mobile or cellular phones were non-existent, and now everyone has a cell phone virtually. We also have social media, we have email, we have several ways of communicating, and yet somehow we're more isolated. We're not talking to each other. If you find a group of persons in a room, not infrequently, yes, you may have 2 or 3 chatting, but then we go back to our devices. What are some of the signs that you might be stressed? And I think we can all relate. Irritability, feeling anxious or worried, having racing thoughts, problems concentrating. We may have problems with our appetite, or just a queasiness and a discomfort in our tummy. Or as we say in Antigua, bad feeling, a constant bad feeling. And difficulty sleeping. Stress affects the entire body. But some of the things we spoke about insomnia already, The problems concentrating can cause this fog, this almost like confused and dazed state. Changes with our moods, headaches, fertility problems, low sex drive, menstrual problems and irregular periods. Persons may experience weight gain. Yes, weight gain can be fueled by stress. So, when people would see us and say, boy, you're putting on weight. When we say hard time, things hard, it's not far from the truth. Hard time or stress can indeed encourage weight gain. Problems with our immune systems, which can predispose to infections or even types of tumors, can be seen. And we know of heart disease, which we'll elaborate on in a while. But high blood sugar or diabetes and high blood pressure and palpitations or racing heartbeats are not uncommon. How does stress affect the heart? Well, the risk of heart attacks is, in many studies, has been shown to be increased. A particular author, Song, found that the risk increases more than 30% if persons are having stressful life events. The risk of strokes, yes, strokes, increase by up to 75%. And high blood pressure. So when you say mind your heart, mind your pressure too. More than double the risk of high blood pressure if persons are experiencing stressful life events. Just a quick snapshot. So this is a picture of a heart, not the Valentine's heart that you see, that you're all familiar with. But you will see these two, can you see the arrow? I guess you can see my arrow. These little red, almost looking like little rivers snaking down the heart. These are the coronary arteries. They give the blood supply to the heart because the heart is a muscle, and muscles need blood supply to bring fuel, to bring oxygen, just nutrients in general. If those blood vessels become blocked or narrowed because of cholesterol buildup, or atherosclerosis is the medical term that we use, then you can start to develop problems on exertion. And if you, on top of that, get clots, then you can shut down the blood supply. And if the heart is constantly beating, you don't have time to, your heart is not going to take a break. And if it takes a break, you're in problems. So it constantly is working. And if it's working without getting fuel, it will die. And that's what a heart attack is, or a myocardial infarction is a term that we use. The stress response system. Yes, it's a psychological problem affecting the brain, but that activates certain pathways in the body that affect the organs. So hormonal systems are activated, the nervous system, specifically the autonomic or the sympathetic nervous system is activated, and that sends signals to two important glands next to the kidneys, or lying on, or sitting on top of the kidneys, called the adrenal glands. And the adrenal glands are the glands that produce adrenaline, right? Makes sense? You've heard of adrenaline. So adrenaline comes from the adrenal glands. There's also cortisol, or the quote-unquote stress hormone. That also is produced by the adrenal glands. And those two factors will affect a variety of organs. They cause us to breathe faster. They have the blood vessels in the lungs open up. They start to produce more sugar. The liver starts to generate more sugar for the body. And this is designed to make us more prepared for some threat. Either we're going to run or we're going to fight. So you need to have these systems activated. But again, when they are turned on all the time, it's a problem. So the short run, the blood pressure goes up, the heart rate goes up because of these hormones. In the long run, the blood pressure can stay elevated. Even if you dial it down, the blood pressure may stay elevated. There's inflammation or a variety of molecules, inflammatory molecules that are increased in the body. And we spoke about the increased risk of heart attacks. Not just because of that, but there's an increased tendency for the blood to clot as well. So those were some of the direct effects of stress. But stress can also affect you negatively, indirectly. When you're stressed, you have problems sleeping. And don't knock it, but sleep is critical to good health. Problem sleeping, and there's a tendency for persons not to take care of themselves. They're not going to, not infrequently we find persons not eating on time. They certainly forget about exercise. They start to miss doctor's appointments, miss medications, and are more likely to try to cope with the stress by turning to harmful substances like alcohol or drugs. So there are clear direct effects, but there are also indirect effects that also have negative consequences for heart health. So we know, as we just established, that anxiety and stress increases the risk of heart disease. But if you think about it, having these conditions will also tend to increase your stress levels. Because if you're worried now about your heart health, worrying if you're going to see it through to your next birthday, to watch your children grow up, this in and of itself is a stress. If we know because we're ill, we can't go out to work, that is going to cause financial stress. So the two tend to feed off of each other. If you have stress, it increases the risk of heart disease. But if you have heart disease, and I say heart disease in its broadest sense because strokes clearly are related to that, but having that condition also will lead to increased stress. Another point to make, just in passing, is that the two can mimic each other quite closely, heart attacks and panic attacks, because some of the same pathways are activated. So the heart may start racing, you may start to have chest pain, breathing fast, the blood pressure can go up. So the panic attack and the heart attack can mimic each other. If you have that component of a stressor that initiates it, then you're more likely to believe that this is not a heart attack. But if you're not sure, the safest thing to do is to seek medical attention that can help to tease out if it's one thing or the other by doing more advanced testing like EKGs or ECGs if you prefer, as well as doing special blood tests to see if there's any heart damage. So the two can mimic each other, and sometimes they can coexist. So we know that stress is a problem. How might we be able to deal with this? How can we prevent it? How can we manage it? Don't neglect sleep. We should be aiming for 7 to 9 hours of sleep per day. I know the nurses and the doctors in the room might be looking at me and laughing, right? But do as I say, not as I do, okay? Sleep is important. Exercise is also important. We know that we need water, we know that we need food, we know that we need oxygen, but being active, activity is also critical for health. And not just aerobic activity, which is the form that we will tend to gravitate to, taking walks. Ideally, it should be brisk walking if you're going to do that. That's important, but you also need to incorporate some strength training as well to preserve not just muscle mass, but also bone health and just general fitness. So the two should be combined, not one or the other. Hobbies may be important ways to help you cope with stress, and everyone has their own interests. but don't put them aside. If you love something and are passionate about something, try to, create some time for yourself to do what you love to do, not what other persons need you to do, but things that you love to do. Those things, even if it's half an hour, make some time for yourself. Volunteerism is an important means of helping cope with stress. Right, Valerie? Volunteerism is important. I think the joy that you get from helping others can't be beat. You can't put a price on that. We are blessed with sunshine and wonderful beaches. So use the outdoors. Spend time with your families. Enjoy the Caribbean sun and good weather that we've been blessed with. Faith helps to keep us grounded, but also helps to connect with others. And try to, as difficult as it may be, detox from social media. I'm not saying to completely block these things out, because they have their role and they are a critical means of communication. And I'm sure perhaps many persons are using social media platforms to listen in on this, or we've used these platforms to inform persons about events like this. So they're not, I'm not saying they're bad, but you have to, take control. Don't let it control you. So in summary, stress and anxiety can cause heart disease by direct methods as well as indirect methods. Anxiety can mimic, and panic attacks can mimic, the onset of a heart attack and other cardiovascular illnesses. Engaging with others, volunteering, restricting social media time, pursuing healthy lifestyles, and sleep, of course, are all important stress management strategies. Thank you.
Thank you so much, Dr. Thomas, for that very interesting presentation. I want to ask a question. I'm looking for my goodie bag. Let me see how well you guys were paying attention. I want Dr. Mead and Sumita, can you just stand and face them? We're going to see the person whose hand goes up first. After I ask a question, they will get an opportunity to answer, and if they're correct, Dr. Thomas, listen for the answers, okay? My head is all over the place. I might say they're right, but when they're wrong. Okay, so question number 1. List 3 symptoms of stress. Yes. Poor sleeping patterns, stomach issues specifically. Thank you. Should I go again? Yeah.
Good afternoon, everyone. 3 symptoms of stress:
That's correct.
poor sleeping patterns or insomnia, digestive or stomach issues, specifically bad feeling, as they say locally, and panic attacks.
Okay, Dr. Thomas, is she correct? Fantastic.
Thank
Give her a
you.
round of applause. And we have a lovely book from our 5th anniversary Heart and Stroke Foundation. Give that to her.
Thank you very much.
Okay, now I'm going to invite the audience to ask a question. Do you have any question from that presentation from Dr. Thomas? Very good. We have a question.
Good afternoon again, everybody. Sleep. I love my sleep. I sleep during the day because I'm a little girl and I'm still growing. But what I want to ask, so I might sleep from, let's say, 3 in the afternoon to 5, and then I go back to sleep maybe about 10 until for the next morning. Does that count for my total amount of hours?
Yes. So cumulatively, you're aiming for 7 to 9 hours of sleep per day. If no, getting 1 hour here, 1 hour there, 1 hour there is not ideal because it doesn't give you enough time to really get into that very deep sleep as well as REM sleep, the dream sleep, and these are important physiologically for restoring injury to the body or correcting injury as well as doing, let's say, detoxing your brain of some of the harmful chemicals that build up and even help with memories as well as helping our emotional state. So short periods, yes, they're better than nothing, but you want to have a good long block of sleep as well. We were, if when the certain rural tribes in various parts of the world were looked at, they tend to have this biphasic sleep pattern. So they will tend to sleep a bit near lunchtime. It's not uncommon for all of us to get a little sleepy around that time, and then have a longer block in the evening. So that's not unusual, and that's okay. Because of modern life and living, it's not that easy to do. What I would, or the recommendation is by some of the sleep experts, is that perhaps you should try not to take that initial siesta after 2 o'clock in the afternoon because it might disrupt sleep later in the evening. But if you try and have that quick nap somewhere between 11 and 2, that's okay.
Okay, thank you so much. Another question?
Yes, but Dr. What's his name? Thomas.
Yes.
There's a culture where they have siestas, and recently I heard if you have, a nap, that's really healthy, and then between 10 and 12 is when you really get your most important sleep.
10 and 12 in the evening?
In the night, yeah.
Yeah, so 10 and 12, that's when you tend to have a lot of your deep sleep, and then in the pre-dawn hours seems to be more that dream sleep time period. So, and if you're a bit sleep deprived, you may get into deep sleep a lot faster. But yes, you want to ideally have some good quality sleep around that time that you mentioned, around midnight, just before that, and then a little later on in the evening, ideally.
Okay, one more question. Okay, so it's going to be two last. Someone, yes.
Yes. Good evening to the
Final
panel.
two questions.
Good evening, Doctor.
Evening.
Good evening.
I heard over the years that we only get cholesterol from animal products only. We don't get cholesterol from fruits and vegetables. Can you explain that scenario to me, please?
Well, I wouldn't say I'm a cholesterol expert, but there are foods that have cholesterol in it. Some of the nuts and the plant oils do have cholesterol. But in addition to what you get in your diet, some is actually generated in our bodies as well. But it's not only animal products that, those are not the only sources of fats and cholesterol.
Okay, final question.
Good evening. I would like to know what is the cutoff number for hypotensive and for hypertensive. Because, when the pressure is too high, that is what bring on the stroke and throw you into a different spin.
Mm-hmm.
Thank you.
Over the years, that number has been changing. So we keep moving the goalpost. So initially, they used to say, well, how we go? 100 plus your age, as long as you're under that, it's okay, at least for the systolic. But then we found out that no, that that is not appropriate. So the more modern cutoff, I think most persons would accept less than 140 over 90 as the top number and the bottom number. But even that figure is a bit contested in some parts of the world, like the United States. I also feel that it is it's useful to consider hypertension if it's more than 130 over 80. That is not necessarily a trigger where you start medications, but it is abnormal. Truly normal blood pressure, most persons would accept less than 120 over 80 as being normal. In an adult, I'm not talking about children now. But even that is maybe a bit generous, because we know that even blood pressures over 115, and some would, for the top number, and some would say blood pressures over 100 systolic. Every step above that, the risk of cardiovascular disease increases. So I said a whole lot, but I'm not sure if I answered your question. So I think a safe number to consider hypertension, a conservative number, more than 140 over 90, but that may not be ideal. If you can keep your pressures less than 120 over 80, that's better. That's better.
But shouldn't we be checking the pressure like 3 times every 5 minutes? So when you take the first position, it's real high, you take 5 minutes, it comes right down. You take 5 more minutes, it gone real low. My mouth is big.
You are perfectly right. You're perfectly right. We should not rely solely on that first blood pressure reading. It's recommended to do at least 2, perhaps 3 readings to get a better feel as to what the blood pressure is, and on the ideal circumstances. So there's particular techniques, there's a particular way or standard way of measuring and assessing blood pressure, which we in the medical community, do a poor job of checking it that way as well. we really do a poor job of it, but there's a standard way. Anyway, that's enough for me. Hold on.
Thank you so much, Dr. Thomas. Okay, if you're looking at your programs, you will notice that we should have a patient testimonial, but however, she is via Zoom, but we're having some technical difficulties, so we're going to move on. And we're going to invite Miss Alicia Andrew to the podium to just break the presentation a bit, and she's going to do a solo for us.
Pleasant good afternoon to one and all. I pray that this song will be a blessing to someone in this room today.
So we're going to let me read it and let me video it and send it.
I say a prayer every night. Whatever I do, I'll get it right. With no regret, no guilt or shame this time. No, not this time. Once I surrender, I won't dare look back. 'Cause if I do, I'll get off track. Move ahead in faith and patiently await your answer. What will it be? Sight beyond what prepare my heart and prepare my mind for whatever comes. I'm gonna be ready, strength to pass any test. I feel like I'm so blessed with you in control. I can't go wrong, 'cause I always know I'm gonna be ready. I was free to do what I wanted to, lost everything, but I still had you. You showed me your grace, and now my life's in you, and I thank you, Lord, I thank you. So I'll tell anyone, I'll testify about how good you were to me when so-called passed me by. The truth that you had shown me so much brought down so much mercy on what I see. You know what's best for me. Prepare my heart and prepare my mind for whatever comes. I'm gonna be ready, strength to pass any test. I feel like I'm so blessed with you in control. I can't go on, for I always know use me as you will. I'll pay the price, 'cause you made the ultimate sacrifice. It's all because of you. I didn't have life for how I, as a tribute, as you cannot be. Straight what I see, oh Lord, you know what's best for me. Prepare my mind and prepare my heart for whatever comes. I'm gonna be ready, strength to pass any test. I feel like I'm so blessed with you in control. I can't go on, for I'll always know I'm gonna, be ready. This time I'm gonna be ready, 'cause it's deep inside, 'cause I know he'll be ready. Lord, be ready.
another round of applause for Miss Alicia Andrew. She said it, she hoped that it would touch at least one person, but I'm sure it touched all of us. Thank you so much, Alicia. At this time, we're going to introduce our first patient for patient testimony. Her name is Miss Sandra Herbert. She has been a patient of mine for the last 8 years. 8 years, Sandra, I think about 8 years. And Sandra has heart failure. And Dr. Mead, you know we love all our patients. But sometimes when a patient walks into the room, your heart just skip a little extra beat more than the other person. Sandra does this for me. And I want to thank her so much for the willingness to share her testimony this afternoon. Sandra, over to you.
Hello. Can you hear me?
We can hear you loud and clear. Go ahead.
Good
Sandra.
afternoon. My name is Sandra Herbert. My doctor is Dr. Stevens. I was diagnosed with nephritis in 1995, which caused me to suffer from high blood pressure and kidney infections. In 2000, I was also diagnosed with fibromyalgia, a musculoskeletal syndrome. In the process of dealing with the pain and infections in 2019, I was having chest pains. My body was swollen and my feet were very swollen and I had headaches. I was taken to the hospital, and upon examination, the doctor diagnosed tentatively that I was suffering with my heart and sent me to do an echocardiogram. I did the echocardiogram and was diagnosed with CHF, congestive heart failure. I came to the outpatient clinic at Mount St. John's with Dr. Stevens and did a follow-up with Dr. Mead, the cardiologist, to confirm the diagnosis. Due to difficulties standing, shortness of breath, dizziness, I was placed on oxygen therapy, hence the machine I am attached to daily. It is a slower pace of life. Lots of painful moments. Need help to do lots of simple things in life, which we take for granted. I take medication for my heart, also to control my blood pressure. I limit the amount of liquid I take in daily and take a diuretic to assist the removal of liquid from my lungs, since I now also suffer from COPD as a result of the heart failure. I visit my doctor every 3 months to help to maintain my health. I will continue to do so by the grace of God for as long as I can. This is my short story, living with heart failure.
Thank you so much, Sandra. Give her a round of applause. Thank you, Sandra, for being so brave and coming to share with us. But before you go, I have two simple questions for you. Number one, do you think we are doing our best as the medical community and the community at large to support persons with your condition? And secondly, if you had one health nugget to share with the entire audience here, what would that be? Did you hear that, Sandra?
Doc, I'm not hearing you.
She's not. Sandra, can you hear me now?
I'm hearing you better.
Okay, so I have two simple questions for you. I was asking if you thought that the community, both medical community and Antigua and Barbuda on a whole, are they doing enough to support persons with your condition? And secondly, if you had a health nugget to share with our audience today, what would that be?
I will start with the last one first. The health nugget. In everything and in all things, put God first. Because He is your strength and your help, especially in times of help. It is not something that can be bought with money. So for those who have their health, do everything they can to keep it. It is more important than anything else. But I would say, put God first and lean on Him. The community in Antigua, there's not a lot said about it, because a lot of what I found out about heart failure came from my diagnosis, doing research, having a doctor that listens, being able to communicate one-on-one with the doctor to explain things to you, to get things done. But in the community of itself, I think there needs to be more information that is sent around and centers around heart disease in particular. It's one of the, as they say, silent killers. And silent because you don't hear much about it until it happens to you or to somebody close to you.
Okay, thank you so much, Sandra. Give Sandra a round of applause. Thank you for sharing your story, Sandra. Okay, we're going to rush right along, and we're going to have our second presentation, and that will be done by our very own Dr. Jefferson Garraway. He is an internal medicine specialist in the community. He's going to talk to us about cannabis and how it can affect the heart, marijuana. What else they call it, Doc? What's that? The healer of the nation. What else, Doc? Here. Hear you, Dr. Garraway.
Yeah.
This is different.
Okay. Okay. So now it's going to
one screen, it's in one screen. It's in one screen. Okay, no. One screen? Okay.
look for the presentation.
Next.
But in the previous, the preview, it cannot do the preview. Okay, coming up.
Yeah.
Pleasant, well, it's 6 o'clock after 6. Good evening to everyone. As I was introduced, my name is Dr. Jefferson Garraway, and today I'm going to try to share with you about the effects of marijuana on the heart. Right? So let's just wait for our presentation. Okay. Yeah, so marijuana is a drug that people use for different reasons. It could be for pleasure, spiritual reasons, or even medical uses. It is basically derived from the flowers, maybe the stem, the seeds of a plant that they call Cannabis sativa plant. I guess for now you all may know that marijuana has several different names, as Dr. Osborne was sharing a while ago, but it is known by different names, different street names. Some persons refer to it as weed, others refer to it as ganja, pot, and maybe the audience, maybe someone else could help me. Any? Highly, no? They call it sensimilla. Some persons would refer to it as joint, you know, and also Mary Jane. So there are several different names, and herb. So there are several different names or several different ways to refer to marijuana. So when it comes to the marijuana use, there is something that is very important that we want to talk. It's tetracannabinol. It's actually a component of marijuana that actually contributes towards a lot of the negative effects that marijuana has on the human body. Another thing that I would share with you is that, and for short, it is referred to as THC. So in the future, I'll be referring to that particular component as THC. Another thing I want to share is that marijuana use is now has been increasing for several reasons because of legalization of marijuana and also because of the medical uses. You see several persons are now using marijuana, right? So in terms of its consumption, it could be consumed in different ways. Some persons smoke, which is the most common way, smoking it, and that could be done via blunt. I'm not sure if you have heard about the word blunt before. right? Yeah, also joints, and some persons could be using it in the pipe. So there are different ways. Those are some of the ways that it can be smoked. And also when it comes to the inhalatory form as well, right, there's what we call vaping, and also there's another term that they call dabbing. All right, so those are other forms of consumption. And also marijuana is also mixed with foods or brewed as a tea. Right, so just to give a little bit of perspective, or so we could understand a little bit better, I know a lot of persons here probably drive a vehicle, have a license, or have some knowledge about vehicles. So today we're going to try to compare our heart, or make this comparison of our heart as a vehicle's engine. So the heart pumps blood just like an engine pumps fuel to keep everything running smoothly. Your heart has 4 chambers that work together like pistons in an engine, moving blood in and out to provide oxygen and nutrients to your body. A healthy heart keeps your body moving, and just like a well-oiled engine will keep the vehicle moving. But what happens when something interferes with this engine? So it is important that we take care of this engine, okay, which is our heart. Some of the persons who are at risk to develop negative effects or effects from marijuana use are persons who have heart conditions, heart disease, older individuals, anyone with a family history of heart problems, or even young people with no heart problems can experience the effects of using marijuana. So did you know that marijuana can affect your heart almost immediately after you use it? And this is why when it comes to the effects of marijuana, in terms of its effects, it could be either immediate or it could be what we call long-term. So we're going to look at some of those effects of marijuana. So one of the immediate effects of marijuana, it says that when you smoke some marijuana, when you smoke or consume marijuana, the effect or the chemical or the substance they call THC, it gets into your bloodstream. That chemical changes your heart. It makes some changes in the heart, or there are receptors in the heart to that particular chemical that will then increase your heart rate. The normal heart rate is between 60 and 100. So just by using marijuana, that substance can actually trigger the heart to beat a bit faster, right? So it could reach to about 150 beats per minute. And of course, that can be difficult, and that can pose some problem to the heart. It can cause actually an extra strain on your heart and can increase the risk of other heart problems. In terms of blood pressure, again, the substance THC also causes some changes in the blood vessels, causing a narrowing of our blood vessels. And that makes it a bit harder for our blood to flow. And if you imagine probably a tube from the engine, if for whatever reason it is kinked or it is blocked, it's going to take much more pressure, much more effort to get that fuel out. And it's the same thing happen to our heart. If there is a narrowing, actually that's going to take more strength, more exertion, and of course that's going to cause your blood pressure to go up. So that's where you can have high blood pressure. Decreased blood oxygen level is another immediate effect that marijuana can have on the heart. And your blood, as we know, carries oxygen to your heart and your body, as we said. And marijuana reduces the amount of oxygen-rich blood reaching your heart, like a running car on dirty fuel. It doesn't perform as well. All right, so if you are using marijuana, because of the smoking, especially smoking marijuana, there is this competition of what we call where the hemoglobin or the blood cells, where there's attachment of oxygen. So if there is, if you smoke and there is carbon monoxide, then that is going to compete basically with the oxygen attachment, and there's going to contribute towards decreased blood oxygen levels. Okay, and another thing that could happen as an immediate effect is chest pains. And that chest pain could come because of the increased heart rate, and also the blood pressure can actually contribute towards chest pains. When we speak about immediate effect, we are referring to anything from seconds to minutes to hours, right? And even after the use of those particular drugs, it can actually last for up to 24 hours. Okay, and there are several other factors that could also contribute towards the effect of marijuana. For example, it depends on the dosage of the marijuana. It depends as well on the form of consumption as well. Those are some of the things that could actually contribute towards the effect it may have on one person to another. In terms of the long-term effect, it can also cause atherosclerosis, as we were speaking about the buildup of plaque, cholesterol, right? And that is so because the THC actually damages the inner lining of our blood vessels. And once there's damage of the inner lining of the blood vessels, of course, that is going to cause an increased chances of the buildup of the cholesterol and also formation of blood clot as well, as thrombosis is also another, blood clot formation is also another complication or effect of the marijuana. So, and if we have to look at our vehicle, same thing happens to the piston. If the piston has excess grease and so, that is going to cause a little bit of difficulty, which could also contribute towards other cardiovascular problems. Heart attacks, as we mentioned earlier on, is another long-term effect. It says that for people with heart conditions, using marijuana can trigger a heart attack because of the sudden strain on the heart. And according to research, it suggests that within 1 hour of using marijuana, the risk of a heart attack increases by 5 times, right? So the same thing, according to the vehicle, it says that too much of black smoke save your car from a heart attack. Do engine decarbonization. So same thing. If you have too much of black smoke, it could be toxic. Same thing with marijuana. If it is consumed in the form of smoking, and so that as well can contribute negatively to your heart. So you want to avoid it as much as possible. Now, medical marijuana should be regarded in the same manner as any other drug. All the drugs that we use, they have side effects. Even the medications that you use for your pressure, for your blood sugar, etc., there may be side effects of those medications, right? And specifically speaking about medical marijuana, persons may say, oh, it's a natural herb. Yes, it is natural, but it doesn't mean because it is natural, it may not necessarily be and may not cause you harm, right? So this is why it is important that even when we use it for medical purposes, if you decide to use it for medical purposes, that needs to be done in an appropriate, you may need appropriate counseling, and of course need to be prescribed by someone who has experience, and of course that needs to be tested. So in conclusion, it says that we need to think before use. Your heart is like the engine of your body. Without it, nothing works. Just like you wouldn't pour the wrong fuel into your car, be mindful of what you put in your body. Marijuana may seem harmless, but it puts stress on your heart. If you already have a heart issue or are at risk, think twice before using it. Your heart works hard for you, treat it well. And the final thought, next time you think about using marijuana, ask yourself, would I want my heart to run like an overheated engine? Take care of your heart. It's the only one you have. Thank you.
Right.
Heart health made ridiculously simple. Give Doc another round of applause. Thank you so much for that presentation, Dr. Garraway. Question number 1, Dr. Mead, Dr. Sumita, getting to positions. Okay, Dr. Garraway, you ready? Okay. THC stands for what?
Good afternoon again. That's why we sit at the front of the class, right? Tetracannabinol. Thank you.
Okay, okay, what's that? Yeah?
Tetrahydrocarbinol.
Yeah, that's right. Okay. Dr. Thomas spoke about stress on the heart, and so we're going to give our wonderful nurse there the stress ball. Nurse, when they're stressing you on maternity, just squeeze your stress ball, and that will help to relieve your stress. Oh, I'm sorry, ICU, not maternity, ICU. Thank you.
Okay, I was
Doc,
asked.
I have a question for you guys.
Yeah, when it comes to the effects of marijuana on the heart, how can we classify the effects? And give one example of each.
Okay, so there is the immediate effects, so the increased blood pressure, and then the long-term effects, which would be the cardiovascular diseases, strokes, etc.
Yeah, that is correct.
Fantastic. Thank you so much. Sumita, can I give her this? Okay, now we're going to... Okay, so now the audience, you're going to have a chance to ask Dr. Galloway a question. Yes?
What I noticed that you're stressing on marijuana. I can talk loud.
Yes, they need to hear it. Yeah.
Be me, you know. Yes, good evening. What I want to know, the most likely you're stressed in on marijuana, and heart attack. What about the person that doesn't smoke marijuana at all and have a heart attack and get a heart attack?
Well, exactly. As Doctor said earlier on, there are several risk factors. He mentioned all of the risk factors earlier on, including the stress and the anxiety that could actually contribute. So it does not necessarily mean that persons who have heart attack are only persons who use marijuana.
But I notice you're all stressed in, and that's marijuana straight. You know what I mean?
Okay.
Yeah, there are several factors that could contribute, several factors. But this is just one of the...
All right, thank you. I could expound on that. Okay. But the topic was the effect of marijuana on the heart, and that's why we're focusing on it. But the other risk factors, we can go through it. Hypertension, which is high blood pressure. Diabetes. So diabetics are at double risk for heart attacks. Now, you want to keep your HbA1c less than 7% if you're diabetic. Elevated cholesterol, smoking, marijuana, plus tobacco, lack of exercise, obesity, and being overweight. Stress does increase the risk of heart attack. So we're covering all the risk factors. And I wanted to just highlight that I do see it. The young people, it's the majority that I see it more in the young persons, the effects of the marijuana. Heart rate increase is one of the more common symptoms they come in with. My heart is racing, irregular beats, but I have had patients 25 years of age with a heart attack. And marijuana was the risk factor identified. We are walking down the street, persons just have a spliff. You're driving by, a long spliff as they drive past you. It is a problem. We need to tell our sons, nephews, cousins, all of us know somebody who's smoking marijuana. Yes, and the daughters, and the sisters, and the nieces. We need to, because I don't think they know. They think it's cool, they think it's fashionable, they think it's the in thing. It can cause heart attacks. And so they need to be aware of that. Okay. Well, they said it's a decriminalization, but we're taking it like it's a legalization. Everywhere you go, it's there. So it's a major issue, and we wanted to highlight that.
Good afternoon. I have a question. So what if I don't smoke, but my friends smoke, and I'm surrounded by smoke daily? What are the effects of that? Is it worse than if it was tobacco smoke? Or?
Okay, so basically I like that question. So secondhand smoking, just like tobacco, is the same thing that happens, all right? And at this present moment, there are still studies being done. Because from my research, I would see that a literature would probably say that it is just as equal, secondhand smoke as smoking, and others would say the actual smoking is actually worse than the secondhand smoke. Nonetheless, both of them, you can actually have the effects. And I would also want to share with you, with regards to parents who have children, secondhand smoking, you have your child is around you and you think, oh, no problem, I'm smoking. That is also affecting the child indirectly, using the secondhand smoking. So it is something that we really need to be mindful about, and as you said, continue to educate persons on the negative effects that it actually have on the human body, and in this present setting, on the heart.
Okay, the question that the gentleman asked at the back, that was basically what I was about to ask. However, we mentioned that marijuana, one of the uses for medical purposes. So can you tell us in terms of the medical side of it, what is it good for, quote unquote?
Okay, so basically, from my research, they're now, maybe not necessarily in Antigua, but they have actually been approved the use of marijuana for when it comes to one of the, I don't remember the exact name of the medication, but for epilepsy, for example, and some persons also use it, it's also used for the pain relief with regard to cancer patients. So those are some of the medical uses, but they also say that it could be used for nausea, vomiting, and other different illnesses. But the problem with that, although yes, some studies are being are done and they have been seeing some effect where it could be used, there are studies that are continuous. However, it is important for us at home. Because we know it's good for headache, let me drink marijuana, let me smoke a joint, it's going to help me. No, remember, as I said, even though it is natural, it has negative effects as well. And I'm not talking about specifically marijuana, all of the natural bushes that we use. Okay, so yes, you can be from the person say, I don't want to take the normal tablet. I prefer to do something natural. But who is guiding that natural thing that you're speaking about? So that's what we need to be mindful of.
Okay, final question.
I was going to ask if there was anybody from the emergency area or any of the doctors who work in emergency here to say how many patients they've seen with that effect. And can I also put it on the medical association? Sorry, can I put it on the medical association to present a case to the government to, what would I say, delegalize?
Yeah.
Please?
Okay. So I hear your comment, and Dr. Mead has actually shared from her personal experience. She may not work in the emergency department, but as a private physician, she does see patients, and she have just testified of patients that she has seen with the negative effects. Okay.
Yes, we should start recording from the emergency room because it was discussed at the symposium, and the only way change is going to happen if we have data. And we would want to record what's used, the frequency of use, the mode of using it, and what did the patient come in with, the symptoms, and what's the endpoint. So yes, that's something we may have to put in place. Yeah.
Okay, our final question.
My question is cannabis usage safer than others, especially in reference to the oils or like when you use it in dabbing and such?
Yeah, so as we said, there are different forms of consumption: smoking, vape, inhalation form, the mixture of foods, where it is used in foods or tea. So what they're saying is that if you use the dabbing or the inhalatory form, the effects are normally much stronger, right? Because that is where you actually have concentrated oils with increased levels of THC, as I mentioned, and that is normally worse than the smoking, right? So as I said, smoking is more common, but then in terms of the negative effects, it is increased when it comes to the inhalatory form. Now, another thing I want to share with you on that topic is that when it comes to the consumption, as we spoke about the immediate and so, with the consumption of marijuana through a cake, whatever it is, the edibles and so, it takes a longer time, about 2 hours or so, 30 minutes to 2 hours. So it takes a little bit longer time to have the negative effects compared to smoking that maybe in seconds, 2 minutes. But in terms of the effects, it's worse when it comes to the dabbing and the vaping part of it. Because dabbing, basically, as we spoke about, there's oil concentrates, marijuana that contain increased levels of THC, which is that stimulate this particular substance in marijuana, and persons will basically use it as a smelling, right? Inhaling. It's almost like using.
Yeah. Dab it on your hand and dab it. That's very careful.
Yes. Good afternoon, everyone. With regards to this forum, I'm glad that I'm here to experience this knowledge that has been sharing. However, within the school, because of the youth, a lot of them seen it as a style, and they're just practicing what they've seen. I mean, if you take this forum to the school, it will edify the students with regard to taking precaution and embarking on this journey with the marijuana.
Yeah, I do agree.
Good evening. I have a question which is basically pinned towards vaping. So, which one would be worse in terms of smoking and vaping? Because right now we see a whole bunch of vape carts out on the street. We have the nicotine ones and you have the THC ones at that. And most persons don't know as vaping the nicotine ones, that's basically vaping away a whole box of cigarettes. As much as it's flavored and looks colorful and so forth, it's just tobacco 2.0 rebranded and repackaged. I can talk from facts about that. When it comes to the THC aspect, it's the same thing. However, these people who are selling you these cartridges, they don't tell you the amount of THC levels or CDBs, the amount of pesticides that you find within these carts and so forth, and it can send you down a negative trip in terms of having lung infections and so forth like that. So I really would like to know which one is safer and so forth and so forth. No. There's a reason why I'm asking. There's a reason why.
Well, you actually answered the question yourself. As you said, with the vaping, the inhalatory form, you don't really know the content or the concentration. So, of course, for this reason, it is actually considered to be the worst one out. I don't know if that... No, I was saying that you actually kind of answered your own question, because you were saying that with the vaping, with the amount of the content, right, there's no specification. And that is where you said people just go vaping, and, they're taking in a whole lot more, right, than the one joint that they may smoke. If I say.
Okay, thank you so much. Give Dr. Garraway another round of applause. In audience, you have been sitting for a while, so I'm going to ask you to stand, and Sumita is just going to do a 30-minute of breathing with you. 30 seconds, sorry, I'm so sorry, 30 seconds, just for you to change your position. I didn't warn her about that, but I looked at you and I see you wanted that, you needed that.
Good afternoon, everyone. So if it's 30 seconds, just follow my lead. Can you sit down for me again and then get back up? And then get back up. And then sit again.
Yes.
And then get back up. Reach your hands up and shake them around. Lower them down. Inhale through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. One last one. Inhale. Exhale. Have a seat, everyone.
Oh, fantastic. You see your faces look brighter. You see? Now you're ready for our final presentation. A foundation such as the heart, and Stroke Foundation cannot run without partners. And so we have several partners, but this afternoon, one of our partners is represented here in the form of the Medical Benefit Scheme, and I'm going to ask that partner to come forward, and she's going to share a health poem with us. Justina France, come forward.
Good afternoon, everyone. So this poem is entitled, Stay Healthy, Stay Strong. Oh, your body is a temple, not a drive-through lane. Skip the fries and the sugary campaign. For non-communicable woes are no laughing jest. Prevention, dear friend, is truly the best. Get up and move. Don't Netflix all day. Let those muscles work, not wither away. For heart and for lungs and your joints in the mix. Exercise daily. It's not a quick fix. Say no to the smokes. Don't flirt with that puff. Your lungs deserves better than that tarry stuff. And while the wine whispers sweet in your ear, moderation, my friend, keeps your mind clear. So eat your greens and watch your plate. Let fiber and veggies determine your fate. For health is wealth, a treasure profound. Take care of yourself. Please stick around.
Fantastic. Thank you so much, Justina. Okay, we have our closer presentation. We're going to have Dr. Osborne. What's my name? Osborne Stevens. Do you think we're related? Ah. I'll let you figure that one out. All right, Dr. Gaydon Osborne is our sole neurologist on the island. He is busy, he's overworked, but he's always willing. And he is one of those doctors, like all of us doctors here in the room, love our patients dearly. And so Dr. Gaydon Osborne is going to come and talk to us about stroke. Welcome, Dr. Gaydon Osborne.
All right, good evening, everyone. All right, y'all look like you're full of energy, especially after that exercise thing. You have some refreshments on the side waiting for you. All right, so today I wanted to do a very simple presentation. We're talking about stroke. You know, growing up, I used to hear, don't drink coconut water at night, you might get a stroke. Don't go in the fridge after you come out from playing cricket, you get a stroke. None of that is true. All right, I've proven all of that wrong. I've been hot and sweaty in front of the fridge, drinking water with the fridge door open. Nothing has happened. I've eaten bananas at night. I've drank coconut water at night. None of that nonsense is true. All right, so that myth is dispelled right now. So I'm going to talk about stroke, the actual definition of stroke. All right. So first of all, with every presentation, I have to have disclosures. If people pay me to say these things, I have to tell you. Luckily, no one pays me for this. If anyone wants to pay me, I'm willing to take the cash. All right. So we have three objectives. We want to know how to identify a stroke. If a stroke is happening to you or your loved one, you need to recognize it, so you alert the 911 and come to the ER, etc. We need to learn about the different types of strokes, and we need to understand what puts you at risk for having a stroke. All right, everybody still with me? Yes. All right, good stuff. So what is a stroke? So it is defined as a sudden onset of focal deficits. All right, focal meaning one side of the body. All right, so you'll have weakness in the arm or leg, problem speaking, a droopiness on one side of the face, and I'm sure all of you guys have seen that, or you have some loved one who you know had a stroke at some point in time, correct? Yeah. All right. So you may wonder, why is it they call it a stroke? What does stroke mean? It's called a stroke because it happens in a stroke of time. So one moment you're good, and the next moment you're very weak, you wonder what is happening. Sometimes you may be very confused, okay? All right, so let's talk about some numbers, all right? So we always think about causes of death, and the first thing that comes to mind is cancer, right? There are many cancer awareness things, prostate cancer and breast cancer and colon cancer, lung cancer. We talk about smoking and how marijuana and tobacco can cause lung cancer, but heart attacks kill more people than cancer. Strokes kill more people than cancer. This is data not from me, from the WHO. All right, so who are you going to trust? All right. Everybody can see that? Oh, no, somebody help me out. Oh, we're back? Okay, so everybody can see that now? Yeah. So take a good look. Huh? They say they want to see it a little bigger. They can't do that? All right, so the first line shows, it says ischemic heart disease. You see where that blue line going all the way over to the right? That's a lot of deaths, all right? That's the leading cause of death globally. Nothing kills you more than heart disease, okay? The second leading cause of death globally is stroke. All right, so those are the two things we're here to talk about today. Y'all learned a lot about the heart. Now you're going to learn a little bit about the brain. Okay? All right, so stroke by the numbers. These are just some kind of fun facts that I wanted to include to get you guys thinking and, to sober you up just a little bit. So every 40 seconds in the United States, someone has a stroke. All right? In America, they're doing a little bit better with their stroke here than the rest of the world. So stroke is not the second leading cause of death in America, it's the fifth leading cause of death. All right? So we just kind of probably need to get the resources and pattern the healthcare so that we can get there. We can reduce the incidence of stroke in the Caribbean. All right? So this other thing here where it says about 55,000 more women than men have stroke each year. Women tend to live longer. You guys are doing something that's better than what maybe we're too risky or something, We we don't, huh? You go to the doctor, exactly. So you live longer, but by and large, living longer puts you at greater risk. All right. Just think about it. If you live longer, you're more likely to have a stroke. All right. Another reason why women have more strokes is because there are fluctuation of hormones, and these hormones can somewhat determine your heart rate, your heart rhythm, and also how clottable your blood is. All right, if you tend to make more clots, then you can cause more strokes. Does that make sense? Yeah. All right, very good. And 1 in 4 persons will have a stroke. 80% of strokes are preventable. So that's the good news out of all of these numbers. Okay. All right. So how can you spot a stroke? Everybody can remember little nifty mnemonics. So my mnemonic is be fast. Can you say that? Be fast. All right. Very good. So B is for balance. E is for? F is for? A is for? S is for? And T is for? So we're going to delve into each one of these just a little bit. All right? So anyone ever felt dizzy? Like you just wake up and you feel a little bit dizzy? So that can be a sign of stroke. All right? Sometimes dizziness on its own is really nothing. You may have an ear infection. Your blood pressure might be a little bit low. Maybe you had too much to drink. You feel a little bit dizzy. But dizziness in itself with other symptoms can definitely be a sign of stroke. Different people have different meanings for dizziness, and as physicians sometimes we get into the nitty-gritty of whether you feel like you're moving and you're not, or the environment feels like it doesn't matter. If you feel movement that's not happening, you're dizzy. Okay? That's something to pay attention to. The next one is eyes. So if you have sudden vision loss in one eye or in one field of vision, then that is a sign of stroke and you need to come to the ER immediately. The next one, everyone has seen this, the drooping of the face, and we see the drooping of the face on one side. So this gentleman on your left, tell me which side is drooping. Left. You sure? Yes. Is it? No. So look at him. He's smiling. The left side of the face can come up, but the right side is still lower. The right side is not moving. Yeah, no, the right is bad. The right is the bad side. Right. His right, not your right. His right. All right, very good. What about that lady? The opposite. All right, very good. All right, so if you see this is a sign of stroke. Yeah. All right, so A stands for arm or leg. All right, so if you have weakness in one arm or leg, also numbness in one arm or leg, it is a sign of stroke. The next one is speech. So we say slurred speech. So, some people may sound like they're a little drunk. If you wake me up at 5 o'clock and try to talk to me, I'm going to sound like I have a stroke. I'm going to be slurring, so maybe not. But language, if you're speaking to someone and they're just not making sense or they're not understanding what you're saying, that is certainly a sign of stroke. In the age of technology, we're text messaging each other and we're even sending voice messages. If someone who usually texts you very eloquently, very nice English, suddenly sends you a text message and it's really not making any sense, it's either an error, maybe, a child is playing with the phone or something, or they're having a stroke, and you should probably call them and say, hey, everything all right? And say, you're sending me this text that just doesn't make no sense. All right? So please, please, please do that. All right, very good. And then T stands for time. All right? So, time is very important. Once a stroke starts, every minute that passes, 1.9 million brain cells die. 1.9 million. All right, that's a lot. All right, and for every hour that passes, it ages your brain by 3.6 years. All right, so I think that's a sobering thought. So the quicker you come to the hospital, the quicker we can diagnose your stroke and treat you and get you to rehab and all of that. All right, get you back on your feet. So what happens exactly? All right. So like we said, 80% of strokes are preventable. It happens when a blood vessel that carries oxygen and nutrients to the brain is either blocked or it ruptures. And what happens is a part of the brain that blood vessel is supposed to supply eventually dies, and they lose function. All right, that area of the brain loses function. So there are two major flavors of stroke, like ice cream, vanilla, chocolate. So they're the ischemic strokes, right? That's caused by a blood clot, and that makes up most of the strokes, up to 87%. Okay. There's also the hemorrhagic stroke, which is a bleed, and that bleed can happen in multiple areas of the brain that we'll see in just a little bit. And we like to call it intracerebral hemorrhage. All right, so this is a really nice picture of the brain, right? So you see the different layers. You can appreciate the skull, all right? So just beneath the skull, there are some blood vessels. Sometimes if if somebody hits you across the head, you have trauma across the side of your head, you can get a bleed, all right? That's a bleed inside the skull. It's called an epidural hematoma. The typical story is that the person had a trauma, they fainted or passed out for a little bit, and they woke back up and they're seemingly completely fine, and then they go down again, and that's it, all right? There's an area of the brain the entire brain is essentially covered by a film, so to speak, to kind of protect it, and that's called the dura. All right. So outside of that dura is where you have that kind of stroke that we spoke about, but beneath that you can also get bleeding, and that's called a subdural hematoma. All right. So you can see that in elderly patients who may have had a fall. They fell and they hit their head. They may or may not be on blood thinners, so that puts you at greater risk for that kind of stroke. Unfortunately, and I say this with a heavy heart, back in the day, they used to, young parents used to get frustrated with children when they cry too much, and they shake them. And, the children will suddenly stop crying and go limp on one side. You also get a bleed, a brain bleed called a subdural hematoma, and that's called shaken baby syndrome. All right, I have never seen it, so I'm thankful for that. And then deeper down in the brain, you can have some smaller blood vessels that pouch out, called an aneurysm, right? And these can rupture, and this can be very catastrophic. Okay. So the patient will usually come in with a really bad headache. The typical thing that we hear is that the worst headache of your life, or they may lose consciousness, or suddenly you have the headache and then start to throw up, and they're weak, and they're not too familiar with their environment. There's some confusion and such, and that alerts us to get a CAT scan, and sometimes we find that this is an extensive bleed, and they may need neurosurgery and such, all right? Luckily, this is not the bulk of the strokes that we see, okay? You agree with me that's lucky? Yeah. All right. So what puts you and me at risk for having stroke? Number one, hypertension. You heard a lot about hypertension today and normal blood pressures and where your blood pressure should and should not be, all right? But next up is diabetes, just as bad, all right? There's an irregular heartbeat called atrial fibrillation, all right? So this is what we call an arrhythmia. So everybody with me, I don't know how great you guys are at rhythm. We are all Caribbean people, so we got some rhythm. I want you to say lub dub, lub dub, lub dub, lub dub. You hear that nice rhythm? Right, everything is in sync. But when we have an arrhythmia, the rhythm is off. All right. When the rhythm is off now, the blood doesn't flow nicely, so it pools in some areas of the heart, and stagnant blood tends to clot. So these little clots can get thrown up to the brain and cause a stroke. How easy is that? You want the rhythm again? All right. All right, let's go again. Love dub, love dub, love dub. That's good for you? All right, good. You want to hear the abnormal? I can't do it because I have rhythm. I have rhythm, I'm sorry. All right. So you heard about cholesterol as well. So high cholesterol, particularly the bad cholesterol, you'll hear about the LDL. That's the bad cholesterol that puts you at highest risk for stroke. Smoking, you heard a lot about that today. So smoking anything puts you at risk for stroke. It damages your blood vessels, okay? A sedentary lifestyle, oh, how we are guilty. All right, so you got to keep moving. So back in the day, summer holidays, you're hardly in the house. You're outside playing cricket in the road. You're playing football. You're just running up and down like crazy people when you're with your friends in the village. We got to get back to that as opposed to being behind the device, the PlayStations, the TikTok and all that. All right. We have a world-renowned nephrologist in the building. So kidney disease, it's a high risk factor for stroke. Alcohol intake, high risk factor for stroke. And of course, diet and nutrition. If your diet is bad, nutrition is poor, then you're putting yourself at risk for strokes. Okay? All right. So blood pressures, we spoke about a number. When I made this PowerPoint presentation, we said greater than 130/80. I think it's kind of consistent with what Dr. Thomas was saying. If you aggressively control your blood pressure, you can reduce your risk of stroke by up to 60-something%. Okay? Patients with diabetes may need to reduce that top number a little more to less than 120. That may be a little bit tight for some people, and that can reduce the risk of stroke by up to 41%. So regular screening is very critical. So if you have your doctor's appointment, make sure you don't miss the appointment, okay? All right, diabetes. So we spoke about diabetes also being an independent risk factor for stroke, and it's worse if you're older. All right. If you've had diabetes for longer than 3 years, this can increase your risk for stroke by up to 70-something%, 74%. Okay. So Dr. Mead just mentioned checking your HbA1c. All right. This is a number that looks at your sugar control over about 3 to 4 months or so. All right. And that number that we want is less than 7%. Okay. We've seen people who are 10 and 12 and 14. Yeah. Yeah, not good, not good. All right, so we went through the lub-dub exercise, and you guys understand atrial fibrillation. So atrial fibrillation is when the top chambers of the heart kind of just quiver, don't really move really well. They tend to pool blood, and stagnant blood does what? It clots, and those clots can get sent up to the brain and cause a stroke. Okay. So these people may need to be put on some strong blood thinners. And anyone has ever heard of warfarin? Yeah, you've heard of Xarelto. Anybody in this room? Okay, good. On TV. All right, yeah. So when someone has atrial fibrillation, we doctors like to look at numbers and what puts you at greater risk and lower risk. So these are some of the things that we look at to kind of make a decision as to whether or not we're going to put you on a powerful blood thinner versus just aspirin or Plavix. Okay. Sometimes, your bleeding risk is too high, and we can't do the blood thinners. So what they're doing now is making a device that can kind of close off that chamber of the heart so that the clots can't form and get thrown up to the brain. It's called a Watchman device. Hopefully sometime we get it in Antigua. So high cholesterol, so high levels of total cholesterol and the LDL, all right, have been associated with ischemic stroke. So this can cause the atherosclerosis, the same atherosclerosis that we see in the heart, same thing we can see in the brain, okay? Some persons have said that low levels have been associated with hemorrhagic stroke, but your levels have to be really, really low. We don't really see those levels, all right? Diet and lifestyle changes are really important for cholesterol control, but if you can't control it with just diet and lifestyle, we can add a medication. You've heard of the statins, you've heard of Lipitor and Crestor, right? Those are good medications, and medical benefit gives it to you for free. People in the States have to buy these things.
Why you have to take it every
So you gotta keep using it to keep it down, to keep the cholesterol levels down. Not necessarily, no. You know, you stop it from building up more. Yeah. So there's a concern about taking the medication every day, and most people who complain about that is people who have side effects. So my recommendation is to have a chat with your doctor. You know, we can adjust the dose, we can put you on a different medication that may not give you the muscle aches or whatever symptoms that you may have from the statin medication. Okay? Smoking. I have to talk about this over and over? Yeah? All right, so it increases your risk of stroke by 2 to 4 times, all right? Even secondhand smoke, Brian, yeah, secondhand smoke can cause that too, all right? So smoking cessation is really important. You know, it's an effective way of reducing your risk for stroke. Sedentary lifestyle, so inactivity, you don't move around. You know, the American Heart Association recommends doing 30 minutes of aerobic exercise up to 5 times per week. All right, you got to get the heart rate up. You have to get tired during your exercise. All right, you have to really work out. If you can't make it that much, if the joints all, you know, you go to the beach, you do your aqua. No, I'm being realistic here. Sometimes your joints and them hurt you, so you go to the beach and you know you get the buoyancy and you get to move around the same way you swim and what's that. All right, you get the heart rate up. Okay, am I lying? Yeah. All right. All right, so kidney disease. Dr. Thomas can talk about kidney disease from now till next year. All right, so it puts you at risk of stroke 5 to 30 times more than the average person. All right, and blood pressure control is paramount in these type of patients. Alcohol. So how much alcohol we should drink? 0. Who says 0? All right. 10% of what? That's 10% proof. So the wine should be 10% alcohol. No, so they used to say that, but that's not true anymore. Okay, all right. So low intake is 1 drink for women and 2 for men per day. All right. If you're already drinking. If you're not a drinker, don't start. Don't start. All right? And then diet, you know. So what you guys think about the diet we have here in Antigua? You think it's balanced? No, not at all. So, all right, what's the national dish of Antigua? Huh? So someone is saying the national dish here is dukkana and saltfish. I hear people saying pepper pot and fungi, and I hear other people saying a company up on Old Palm Road there. Right, I can't call the name, I might get in trouble. I can't take a lawsuit right now. All right. So the views here are the views of the audience and not of the presenter. Yeah, but you're right. Okay, you're very right. So you need a diet that's rich in fruits and vegetables. All right. So you've heard of the DASH diet and the Mediterranean diet. Yeah. So these fish and olive oils and these vegetables, avocado, and sometimes you can really pretty up your plate and your dinner is really delicious. All right, your food is really delicious. Moderation is good. I agree. Mm-hmm. All right. So to conclude, up to 80% of strokes are preventable. So if you can identify your risk factors, control your risk factors, you reduce your risk for stroke. Isn't it just logical? All right, very good. So like we said, risk factor identification is important and controlling these risk factors is paramount. Did you guys have a blast with me? Yeah. All right, very good.
What's my name? Oswald's in the house. Thank you, Dr. Gaydon Oswald, for that wonderful presentation. Ladies and gentlemen, we have come to the end. I have questions for you, but I'm just saying. How was that presentation? Wonderful. Give our gentlemen a round of applause. You realize? We don't have the estrogen up here, testosterone. Wonderful, they did well. Okay, so I have some questions for you because I have 3 more gifts. Question number 1. Dr. Mead? Okay, question number 1. What are the 2 main types of strokes? Right at the back. Yeah,
Right in the back?
You guys agree with me? It was nurse Roach. Nurse Roach, you got a prize already? You hand it over. Nurse Roach, select someone with their hand up to answer, if you don't mind. She selected someone else. She has the power to select. Fantastic. What are the 2 types of stroke?
Hello, good evening.
Good evening.
It's ischemic and hemorrhagic.
Wonderful. Round of applause. Okay. Sumita, come and give her this lovely stress ball that has Heart and Stroke Foundation on it. I'm going to ask Dr. Osborne to send the next question to you. Dr. Osborne?
All right. So we spoke about an irregular heartbeat. Can you guys remember what it's called?
Aha. Ooh. That one at the back, I think, too. No? What's that?
No doctors allowed to answer.
Okay, this is the young lady in the red. Okay, someone else got that.
Atrial fibrillation.
Atrial fibrillation. Very good. Another question. Final question. List 3 risk factors of stroke. That one.
Sorry. Oh, Stan? Okay. High blood pressure, diabetes, and poor diet.
Very good. Congratulations. Very good. Okay, I have 2 more gifts, but I'm going to make it interesting. You guys are sitting, so no stampede. Catch! Very good. Catch! Oh. Very good. All right, we're going to invite 3 questions for Dr. Osborne. You have any questions, or he was pellucidly clear? Any questions? There we have some questions. Sumita, Mike?
Sorry, who is...
Dr. Osborne, can you go back to your beginning of and making a reference to American and their statistics? And how we must look at them. And how we need to look at them.
This one? That one?
For their
Before that. This one?
I don't even remember, but I'm just saying.
This is global. This is global.
Okay, so
the one before this.
So it was the American.
This is the American statistic.
Right, and what was it we were to look at them for?
Oh, for how well they're taking care of stroke. So globally, stroke is the 2nd leading cause of death, but it's down further down on the list for America. It's the 5th leading cause of death.
And you also spoke about the time frame. Okay, so I just recently experienced time frame, and my brother not being given anything at the first hospital for his stroke. He had the dizziness, his blood pressure was up, and by the time they got to the 2nd hospital, and then to a 3rd, the time frame was gone. He's too old for surgery, so it's just like palliative care now. He's still alert.
This was in the States?
Yes.
That's
So
unfortunate.
that's just one person, but when it comes home to you,
that's correct.
It's
yeah,
really
it's a
hard,
big impact.
you know?
Yeah.
Okay.
You're right.
So
Now they're doing things where they're having a mobile stroke unit. So you'll be able to get a CAT scan and start getting medications in the ambulance on the way to the hospital. So hopefully that mitigates some of that problem.
My question is, per se, if I had a stroke, what would be my increase of having another one?
So unfortunately, having one stroke is a risk factor for having subsequent strokes. Yeah. And that risk can be anywhere from 25 to 50%.
Yes. Okay, final question.
Yes. I've heard about the elevation of the blood pressure and the stroke. Is it possible to have a stroke with a slightly elevated blood pressure, or should it be above the recommended 130/18?
So there are times when we see strokes and persons have normal blood pressure.
That's correct.
Many a times I see this, it's because they have the irregular heartbeat. All right, so you form the clot and you throw the clot, and that causes the stroke. No. Yeah, be fast. Exactly. Very good. Very good.
Dr. Osborne, is twitching bad? I really have a concern. The other day, this eye was just twitching. Just twitch, twitch, twitch. It won't stop. Then it got swollen. I, on the other hand, I'm reading too much. I said, this must be stroke.
Yeah. So
I want to know if twitching could cause the stroke.
So the answer to that is simply no. So, your eye can twitch for several reasons. All right.
But it was the muscle torn. So
the muscle was torn.
Yes, so they measured the maxon, tightened the levator, and give me 6 months to heal.
Very nice.
If it doesn't go back, 'cause it was getting small.
Yeah, I'm very happy that you learn all these medical terms. Very good. Very good.
The thing is, I think I read too much. I need to just...
No such thing as reading too much. You just have to read the right thing.
I think I'm typing from the time I was like that.
Yeah.
Right? And then doing all those reading, all those typing. Then a netball pole licked me down in my head more than 40 years ago.
Wow.
So the retina was torn.
The
retina was sealed off in Guadeloupe more than 40 years. So could that cause the
twitching?
Yeah.
So the retina would not cause the muscle twitching. They are not intimately related. All right. Like you said, you had a tear in the levator and such. Yeah. So that in itself can cause your twitching. But sometimes, other than that, we don't get enough sleep, or fatigue and stretch, and stressed out, and we have twitching in the eyes. All right. So that can cause twitching. Also, very real. Well, not really, but we also see persons with seizures who have twitching in the eyes. All right. So eye twitching can be from multiple different causes, but usually not stroke.
Okay, thank you very much. Before we
have
wrap
a
up, we have
question
one
online.
online. That will be our final question.
So the question is, can someone practice a healthy lifestyle and still get a stroke?
Yeah, the answer is yes. The answer is yes.
Okay.
All right. So you can have a healthy lifestyle. Some persons may have an abnormal opening in the heart that can cause blood clots to go from one direction to the other direction, leading up to the brain, and that's really unfortunate. However, we don't see that much. This is a stroke that we see in young persons, but we don't really, we haven't seen much of that here at Mount St. John. So thankful for that.
Okay, thank you. Earlier in my introduction, I did mention that this year, the Heart and Stroke Foundation is celebrating our 5th anniversary, and this was on the 3rd of February. And the foundation is made up of directors, but the foundation will also not be the foundation without friends of the foundation. So at this time, I'm going to call in a friend of the foundation in the person of Dr. Thaddeus Smith to make a contribution.
A very pleasant good evening to each and everyone. And as you know, if you're having a birthday, you should have some cake. If you're having an anniversary, you should have a cake. Because a cake is one of the ways that you celebrate. And this afternoon, because it's the last activity for the 2025 Heart and Stroke Foundation activities, it was fitting to have a cake to show that the Heart and Stroke Foundation is 5 years old. And we want to say a very heartfelt thank you. We are very grateful to Mr. Victor Mackey Jr. He was the one who made the cake. And yes, it's a healthy cake. And I'm sure if you are able to get a piece, you can always tell us what type of cake it was. So once again, let's just say cheers to the Heart and Stroke Foundation in 5 years, and it's still moving strong. And we do hope that with your help, we'll continue to move stronger as the years pass by. Thank you.
Okay, and we are at our final presentation where Dr. Samita Baluja, one of the directors of the foundation and the vice president, will come and give the thank yous. And then you will have some delicious, healthy refreshments before you go.
Good evening, everyone. As we come to the end of the first public lecture hosted by the Heart and Stroke Foundation of Antigua and Barbuda, we would like to thank several persons that made this possible. Thank you to our presenters, Dr. Garraway, Dr. Thomas, Dr. Osborne. We are grateful to you for a layman's breakdown of several topics which were highlighted earlier in the month at our 6th annual medical symposium. These topics focusing on chronic stress, anxiety and depression, and their impact on cardiac health, the effect of marijuana on the heart, and all you need to know about stroke are topics that plague our community on a daily basis. Thank you, Ms. Sandra Herbert. Thank you to Ms. Elisha Andrew, soloist, and Ms. Josina France for your beautiful poem. A special thank you to ACB Caribbean and West Indies Oil Company for your monetary contributions, Ken's Club, and also our long-standing community partner, Celeste Bird Medical Center, for giving us a home to host this invaluable free public lecture with you, the community. Akeem of Francis Media Productions, and Kellyanne of Yes Management, thank you for always going above and beyond and getting it done. At this time, I would like to ask the board and friends of the Heart and Stroke Foundation to stand. Thank you. Thank you, thank you, thank you for everything that you do. Thank you to the lead organizer of this event, Dr. Monica Osborne Stevens, along with the board and a team of friends of the foundation who pulled all the details together to make this a successful event. You give of your time to help the foundation spread its message and affect lives of each and every person positively. Thank you. Please have a seat. Our hope is that each of you can take away a few points which will allow you to spot the signs and seek help, if not only for yourself, but for your families, loved ones, friends, colleagues, and members of your community. This evening marks the end of a month-long celebration for the Heart and Stroke Foundation, a milestone, our 5th anniversary. The foundation looks forward to drafting and mapping our next steps as to how to better serve, educate, and create better awareness about heart health as we continue on our journey towards our next milestone in another 5 years. We will continue to preach the importance of knowing your numbers, ways in which you can spot a stroke and save a life. We will continue our educational adventure, promoting a healthy heart and a healthy lifestyle to the young ones of Antigua and Barbuda, impressing on them the importance of a healthy body, a healthy mind, and a healthy heart. We look forward to creating more partnerships. We look forward to welcoming more friends. As you leave this evening, we ask that you stay blessed, walk good, be kind to yourself and others, and most importantly, mind your heart. Have a good evening, everyone, and thank you for spending your time with us.
Thank you so much, Sumita. As you go home, be safe. God bless. I enjoy all the presentations, but something that's going to always stick with me, hurry and worry kills people. Because I'm a hurry. I don't worry, but I'm a hurrier. Have a great evening, everyone. Thank you so much for being here. Thank you so much. You could have been home Netflixing and chilling and getting into all kind of trouble, but you came. Thank you.
On behalf of the entire nation, Lady Williams and I offer our heartfelt congratulations on 5 years of remarkable service. We look forward to many more years of shared success and collaboration. May God continue to bless you in all your endeavors.
You are faithful, faithful through all things. You are faithful, faithful through all things. You are with us, we are not alone. You remind us to hold on to hope. When we